to the Health and Wellness Seminar. We're delighted that you have decided to join us as we share ways that each one of us can live our absolutely best life. My name is Dr. Esther Martinborough, and we are so glad that you are here. This is the first part of a three-part series where we are learning to cope with grief and loss. And today, we will be discussing the topic, what type of grief am I experiencing? And then on March 13th, grieving during COVID. And then on April 10th, grief and loss support. And we would be delighted and excited if you could join us for all three parts of this series.
Okay, so this is the only time I'm going to just read from my screen, but it is something I have to share. Please consider your own discomfort level in attending this presentation. When discussing grief and loss, we can experience renewed feelings of grief. We encourage you to seek out support as needed. This presentation is for informational purposes only and is not intended to provide diagnosis or treatment. Okay, so the things that we'll discuss today are the types of grief and loss, the different stages, identifying grief and loss in your own life and in others, and is grief a matter of life or death? So grief, we need to experience the emotion. A lot of times we get so busy with different things that we kind of put our own feelings on the back burner, which is not a good thing to do. There are times when we have to, engage with the public and everything else, but we need time to grieve. And it's a period of, not knowing what else to say or do sometimes. Sometimes you just need to be alone with your feelings and thoughts. Sometimes you need to share with others. It's not a process that is unique to anyone. I mean, it is unique to you. And it's not something that no two people grieve the same way. And it's not something that we need to dismiss. So sometimes people say things like, I'll pray for you. You'll get over it. You'll get through it. It's not that big of a deal. Or they're like, oh, I know how you feel. And then they just share all of their own feelings and not really looking at what you might be going through as an individual. So we need the support of others, but we also need to look at, is it the right support at the right time? And grief isn't linear. When I talk about the stages, it's not something that's supposed to go in a perfect cycle. It can, go from one to the other, and we'll kind of discuss that too. And trying to avoid grief, it robs us of really honoring the loss, because we lose relationships, we lose people, we lose different material things, just anything that comes with any loss, we need to really address it. And when we don't, we're trapped. And then we aren't free. We're not totally free because we're not moving through it. And we need to heal. So how do we heal? We heal through the process of mourning. Okay, so the types of grief. So we have normal. This is controversial to some, because, we look at things and we're like, grief isn't normal. It's not something that we should have to go through, but it is a part of life. And when we don't discuss it, when we act dismissive about it, then that's when things become more complicated. So normal grieving, a lot of times the way we look at it as mental health professionals is that you go through the different stages and it's not as traumatizing. It's something that you kind of go through the different steps that are unique to you, and you're able to continue with your life. And it's not something that's very debilitating for a long period of time. But we do look at normal grief and how it can become complicated, because just because you felt like you're okay, and then you look at it 3 years later, you're like, I'm still grieving the loss. And then we have to look at, well, what are some of the underlying factors? So let's move on to traumatic grief. What does that mean? Traumatic can be very devastating. Usually it's out of the blue. It can be car accidents, violence. We experienced a lot of grief, kind of vicarious grief, when we witnessed a lot of the BLM uprisings. We've seen it for years. And in honor of Black History Month, You know, a lot of the things I wanted to put this disclaimer in there. A lot of the things that I'll discuss are unique to the African American experience. And it's because when we talk about grief and loss, a lot of times it's not directed directly towards this community. But what I'm saying, really, it affects every human being, no matter color, race, ethnic background. But I will be emphasizing different things that have really caused some difficulty within the African American community. So the traumatic loss, when we see murders and different things on television by who we think we're supposed to trust, it can cause a type of grief and PTSD symptoms that aren't seen in other ethnic backgrounds. So we need to really look at that and take that into account when we are discussing, when we are sharing, when we are trying to process the different types of grief that we're going through. So next we have anticipatory. So if someone is sick in the hospital or at home or with a long-term illness, you have chronic illnesses, you have cancer, you have all kinds of things, heart disease, and you know, it's very difficult to watch someone go through these different stages. And then say, you can even look at it like dementia, you know, as people lose their cognition, you know, we're anticipating a slow decline. So that loss of those abilities or loss of life, when you know that it's going to happen, but it hasn't happened yet, you're still grieving. And then when it does happen, you have another type of grief. And then put those together, it can become complicated very easily. We also have delayed grief. That grief happens when, you know, you didn't have time to really deal with it at the time, or you didn't want to, or you've kind of been conditioned not to express yourself or express your feelings. So you withhold it, you keep it in. Guess what? A few months, a few years down the road, it really, really starts to hit you. And sometimes you're not even really sure what it is that's really bothering you because you have not processed it with anyone. You've just kind of kept it in. Or if you have tried to share, people have dismissed you. So that's one of the things that probably affects our community just as much as the complicated grief does as well, which I'll go into now. Complicated grief is just like I was saying before, it can start off normal and then it becomes complicated. And when I say complicated, I mean that it lasts for over a year. It's debilitating. You can't really move from point A to point B. You're not really, depression is usually followed with it. There are a lot of risk factors that, you know, come into play, health problems, you know, and this one affects our community far more than people are willing to discuss. And sometimes we don't even really know what's wrong with us. That's why it's good to try to connect with others and mental health professionals. In that clip, and I wanted to kind of show something that would give us an example to kind of go through like a scenario. So hopefully everyone is kind of familiar with the movie Soul Food. So you had the matriarch that passed away from complications of diabetes. She pretty much was the person that was probably holding the family together. But when we look at the role that this child has had to play in this movie, it's like, it's far too much, but we do see strength there. We see that he is supported by his own mother, and that is great. But look at all the things that were affected and that can cause a grief reaction. So we had loss of relationship, we had infidelity, we had role losses, functional losses. You know, the grandmother wasn't able to cook Sunday dinner anymore. Her arm was burned when she first went in the hospital. She burned the arm, didn't even know that it was burned because of the complications of diabetes. Missed opportunities, you know, people that didn't go to do the things they wanted to do in life. You had jealousy, you had change in the social system, and material loss. And you also had some brother-in-laws that were in there that, you know, one of them was trying to go legit and couldn't get a job, so you had employment loss. So all of that is sitting at one table. And that's kind of how we are in our lives as well. You know, we have all kinds of things going on, but we don't really talk as individuals to try to figure out, okay, how can we help one another to build the family together, to make it better? And one of the things that we've lost is community and sitting around the table and talking and sharing and having compassion for one another. And, like when we have our arguments, we're able to get back together and say, you know what, it was hard. I'm wrong, you're right, whatever it takes to make sure that your family unit is together. But when we lose family members, when we lose relationships, regardless if it's a lot of, death, or if it's just people that can't get along, or, whatever the circumstance may be, we still look to other people. But what do we do when we don't have anybody else? That's when a lot of times when we have to seek a mental health professional. A lot of times we don't want to do that. We have stigma in our community. We tell each other that, well, you're crazy if you go see a person. That's not true. Sometimes you need to speak to someone other than the people in your family, because they may not understand, or they may judge, or you just may feel some type of way about sharing with, someone that's that close to you. But I wanted to also go over, look at the stages. So, you have shock and denial sometimes. And let me preface this. There are a lot of models for the stages of grief. So it's kind of one of those things where the therapist picks the one that they see the most, or the one that they feel like is more helpful to people. This one, I like it because it's kind of more comprehensive. It shows more of the things that I see in my practice the most. So it's not a linear process. It can go up and down and around. So sometimes people come in with depression. Sometimes they come in with anger. Sometimes they're like, okay, I'm hopeful for the future. You just never know which stage you're going to be in. And guess what? They can turn around and fall right back into one of the other stages that are more debilitating. Because as time goes on, they start thinking about other things, or they already had some stressors in their lives, anxiety, depression, and this just exacerbated it, just made it worse. And sometimes they just don't even know where to start. So that's why therapy is good, because although people are like, well, why would I go sit in front of someone and tell them my problems? How will they understand? Well, that's the beauty of it, is that we are looking at behaviors. We're looking at assessment. We're looking at your life as a sum total, not just that one thing, but we start where you are. If you come in and you say you've got anger issues, we're going to flesh that out, but we're also going to look at some of the other areas that may be affecting that may be even causing those problems. And when you have that moment of, oh, yeah, that's where it started, or maybe that's, okay, I get it. And then we start building and helping you move through some of the stages so that you can get to where you want to be, not where we want you to be. Because sometimes, people feel like, oh, well, the therapist thinks that they're just going to tell me what I should be doing. And that's not true. A good therapist is supposed to start where you are and end where you want to be. So if you tell me that you want to, do X, Y, and Z, I'm going to do the most that I can to help you get there. But it's not going to be how I feel you should get there. We're going to work together, partner together to get you there. So one of the things that affects us most are the pain and guilt. So when I say pain, what do I mean? Physical pain, mental pain, all of it. You never know how it's going to affect you. When someone tells you that that they are not able to process their grief properly, a lot of times you're like, why not? I've lost somebody and we don't show our compassion. And then on the flip side of that, somebody may show too much, and it may be too much. You just cannot accept everything that they're trying to give you. So that's why it's just good to be a listening ear sometimes. You don't always have the answers. Sometimes you just need to be there. Community is the biggest thing that has helped us throughout the years. Our communities are broken. Our families are broken sometimes. And it's not unique to just African Americans, but in our own communities, we have to kind of tighten up. We've lost our way a little bit in some places, and in other ones, we've been really resilient. We've been, great. But I'm speaking to the fact that when we look at pain, I have so many people that come to me, regardless if they're friends or if it's professionally, that say, I don't have anyone to talk to. That shouldn't be, because we have aunts, we have uncles, we have, we have all these different people in our lives, but yet we feel alone. We have friends, yet we feel alone. Or we, African Americans, are really good at identifying a problem. But when it comes to solving the problem, we've been used to, like, well, I've got to pull myself up by my bootstraps. I'm not going to be able to, work with anybody else. And that shouldn't be either. We should have trusted contacts that we can go to. And if you don't, or if it's too debilitating, or if you've been speaking to someone and, you know, you're talking about trauma and pain and everything, and they're like, I don't know how to deal with that. That's the time to seek help outside of, you know, your own circle. So the anger and bargaining that we have through our grief process, sometimes we're like, well, you know, if this hadn't happened, this would have happened. And I'll go do this and maybe I'll feel better. You know, like start bargaining with yourself, others. If you believe in the higher power, you know, like you start bargaining that way. And you're noticing it's not working, it's not helping. And then you become depressed and you're sad. You're not really sure where you're going to go next. And, you know, either you work through it, you educate yourself, you do correct coping skills, as we like to call them, and somehow you get through that process. And, you know, you move on to working through acceptance and hope, and you're able to move on. But what about the people that aren't able to do that because the pain is so deep and unique to them that they're like, I cannot do that. I hear that so much, I cannot. And when you are able to get your hope restored and you start saying, I can, that's usually when we see progress and we see change. So who grieves? Everyone has lost something. Everyone, a relationship, a pet, people, you know, and I don't want to minimize anything because sometimes you can lose a pet and it can feel just like you lost your child for some people. You can lose your shoe and have to go to work the next day and you're like, I really wanted to wear those shoes. You feel something in there that's lost. You know, I lost that particular thing. But when we talk about a human being, it goes on a whole different level, right? And it should. But when we look at other people and how they seem to move through, we're like, I'm not like them. I'm not able to talk to anybody. I don't have anybody. I am alone. Loneliness is the thing that is hurting us the most. So when I was looking at the questions that came through before the seminar, and I changed the seminar a little bit because of it. And I think it's because of going through the pandemic and having a lot of death and sickness and illness through COVID and job loss and having to relocate, all these different things that are coming on at one time. People are starting to ask questions that are really, really, really difficult to answer just in a seminar. And I will say that from most of the questions that I got, most of the people would benefit from therapy. It's just plain and simple. And when I say that, it doesn't mean that you have to be in therapy for the rest of your lives. It just means that you need to get through this with the assistance of someone else because the problems are so great. If you continue to just stay in that place, you're going to probably hurt even more. But males, Black males, tend to grieve a little differently. A lot of times they are kind of taught to not express themselves. And that can be males in general, but especially in Black males, because guess what? In our communities, it's like, okay, you gotta man up, you gotta not show any vulnerability, you have difficulty being able to share with others, not that you aren't hurting just as much or more. It's more so that having trusted contacts and feeling like, okay, yeah, I can share this with my boys. I can share this, you know, with my uncle, my dad, my, you know, whoever that person is. Sometimes they want a male to speak to, and that's fine. But when we look at it from a therapeutic standpoint, a male versus female therapist can help anyone. And a lot of times we feel like, well, females, you know, like they grieve differently, or when they lose a relationship, or, you know, if lose a child, lose a parent, lose anybody, that, you know, they grieve differently than men. Men hurt just as much. With the studies that have been shown, there really is no difference in how people actually feel. It's more so in how they process. So if females have been used to, you know, expressing themselves and being able to process their emotions, then they may, you know, do a little better. But as far as males, if they have been taught or just learned not to share, then they go inward, everything's internal, and they do not, you know, really process the grief properly. And it's really, really important for males, especially at this day and age, to be able to seek help, because if we look at it, I think the statistics show males between 15 and 24, the suicide is the third leading cause of death. So, it's pretty important, and it's, really telling that we have people in our community that are really hurting, but there are some that are being neglected, and we need to address it. And the only way we can address it is start having these conversations. If we don't get this out there, especially amongst the community, who's going to tell us? Who's going to share it with us? We need professionals that are willing to, volunteer time to, get the word out, whether it's going to community centers, churches, wherever you have to go to kind of put the word out that, maybe we need to start a group. Maybe, we need to have a discussion about this or that. If we look at some of the places that we used to go to, and especially even in homes, we aren't getting together and just laughing and talking and sharing so we can build relationships where when things do go wrong, we have someone to talk to. So next we'll talk about children and teens. Right now, we've had teens that have lost so much. They're wanting to graduate. They thought they were going to have that whole experience, but quarantine restrictions have kept us in the house, and you can't do the same things. And it's not being addressed, in some areas. In others, there are. And it's hard for them to have hope, because a lot of times kids think in the here and now, and it's like, well, am I going to be able to go to college? Am I going to be able to get a job? Is the world closed? And, so many things have happened. And then they see the violence, and then we see, regardless of your political affiliation, there were a lot of things that have been going on, especially in the last 4 years, that have been really, really debilitating and scary for a lot of people. And children have seen this, and we have to look at what have we been sharing with them? Have we been talking to them? Have we been helping them be able to share how they feel about things? So when it comes to grief and loss, a lot of times kids go inward. They do not share right off the bat. So sometimes you have to, kind of be just a supportive person and let them kind of do it in their own time. And you also help them and let them see that, you're not there to hurt or try to, bring up emotions that they don't want to talk about, but you are there to try to help them process it. And a lot of times you'd be surprised, kids are so resilient, they just need to have someone there to listen most of the time. And then it's like, okay, this is when we can share some little anecdotes to help them move forward. And, if they're able to absorb it, then you'd be surprised how quickly they kind of bounce back. But a lot of times we keep things from children, we don't want them to feel anything, but it's like they do need to know that, people do die, people do lose things, relationships do fall apart, because if you keep that from them, when they do get it around 20 or 25, and then they come see me, they're like, I can't believe this happened. And it's like they've never even had a dog or a bird or a fish to die. So it's like when a human passes away, they're like, they can't believe it. And it's like, because did their parents or people around them ever discuss how you're supposed to process grief, or are we supposed to lose people? What happens afterwards? Those are all things that people have to discuss amongst themselves on how they, how they believe those things happen. Then we have elderly people that lose things. Loss of cognition, loss of ability to do things that they wanted to do. Just because you're older does not mean that you don't still want to do the things that you did when you were 20 and 25. In your mind, you feel like, hey, those things were nice to do, and now they've been taken away. So we have to look at, that brings along sadness. But just because things got taken away, we look at what can be replaced, what can we add value to. People with illnesses lose the ability to do the certain things that they used to do. And caregivers, they have a strong grief reaction because, they're seeing it in real time. A lot of times they don't have support. A lot of times they don't have care. And, it's really difficult for them to go through things. To process things. So let's look at the differences between males and females. Scans revealed that there are some differences in the brain that happen when people are going through different emotions. So a lot of studies haven't been done, but then when you look at the ones that have been done, they're really small. So they can't really just say, point blank, men grieve differently than women. But it has been shown that, there's an area of the brain that controls emotions and blood pressure and self-awareness that's different in males as it is in females. And the theory is that because females tend to process their emotions differently. I'm not going to say better, I'm just going to say differently. So with that being said, is grief killing me? Let's look at the things that are going on in our communities, right? We have a lot of health problems, a lot of chronic illnesses. And we also, in the disenfranchised communities, we have substance abuse, we have violence, we have risky behaviors in any community. But when I'm talking about, the things that are just going on, like kind of with us, and the things that we need to address and we kind of put on the back burner, it's our health, it's our mental health, our physical health. And, let's face it, if we don't address these issues, we're going to continue to die young. We're going to continue to suffer, and that's not living. So is grief killing me? When we are grieving, sometimes we neglect ourselves. We don't eat right. We stop taking care of ourselves. We isolate. We go along with depression or symptoms of depression and anxiety. A lot of times we will just kind of push through. Like we'll go to work, we'll do what we need to do. We come home and we're mean, we're angry, we're sad. And, what does that lead to? People usually pick up negative coping skills. And with that comes, a lot of times it's the eating. A lot of times it's watching too much television. It's trying to find some type of escape to, kind of deal with the problem, but it's not dealing with the problem. It's not even putting the mask on it. All it is doing is most of the time providing some type of entertainment or some type of, sometimes you feel like it's instant gratification, but it's not, because, like if you eat a great big meal and then you're like, like I feel worse now, and then you start feeling guilty. So it just builds this great big cycle. And then you're like, how do I get off of this train? And how did I even get here? I was feeling bad and now I'm feeling worse, but we don't put both of them together. And then sometimes we choose relationships that we know we shouldn't be in because we're hurting or because we're just falling back into our same negative patterns. But it is opportunity to change some things. When we look at the people that we've lost or the situations or the things that we've lost, there is hope, but we have to rediscover the hope, and we have to find out what it is that really motivates us. So let's look at the grief experience in underserved communities. And most of the time, like I was saying before, it's complicated. We have traumatic, disenfranchised. That means that the things that people lose a lot of times are kind of shunned. So if I lose a pet and I try to tell somebody how bad I felt about losing my pet, a lot of times they'll either laugh at you or whatever else, unless they've had one and they feel the same. But that's not how society works most of the time. We don't even want to show any type of emotion. I'm just using this as an example. We don't want to show any emotion as to I lost a pet, or, on a larger scale, if someone has HIV and they pass away and a partner is not able to grieve because that person, never told anybody about that person, they're still hurting, and we look at it and we judge. And that's not something that we talk about very much, but there are, like 100 different ways that, examples of disenfranchised grief. So, we have to look at what is it that people are really hurting from. And that's when we do an assessment when people come in. A lot of times when they say, like I have anger issues, I have this or I have that, but in the assessment, we also have to look at what are the things that you've lost, or people that you've lost. And sometimes these things come up and we find out that that's the thing that's really bothering them. So also we have secondary losses. So when someone passes away, sometimes that takes away income, that takes away places to live. You have the financial loss, the relationship loss. Family members might be arguing. So, not only do you have the loss of the person, you have so many other factors that are affecting it. Lack of supportive services in our communities. Sometimes when we are grieving or when we're hurting or just suffering from any type of mental disability, we don't know where to go. We're like, okay, I know something's wrong, but, why are we not going to be seen as well as others? Or are we going to see someone that we feel identifies with us? I heard a speaker saying, you kind of are able to identify with somebody by the things that they eat, by the things that they say. And, there's just this different shared experience that comes with speaking to another African American. And sometimes that's what you need, or someone that is very well versed in the community. Because when I tell you that, I lost my job, it may not be a big deal to you, but when I have to start telling you about some of the racial factors that went along with how I felt when I lost my position, if I'm not trusting that the person I'm talking to will identify or understand, then I'm not going to want to talk to them. And I'm going to shut down. I'm not going to trust. And then where's it going to go? So if you're looking at it from a mental health standpoint, if I'm seeing a therapist that does not identify with me, it's not going to be very helpful. So when we look at our own communities and we can't find anybody that looks like us, we tend to just like, well, I'm just not going to go. But there are people there to help. I don't want you to feel like, like there's no other, there's no other avenue, but we have to seek it out, and it is a little bit harder. So we also have stigma towards counseling. Like when we tell somebody that we want to be seen by someone, a lot of times people are like, you're not crazy. And it's like, it has nothing to do with crazy. There's no, it has nothing to do with that. It has something to do with, there's something going on with me. I need help. And when I say that, like it's okay, I'll be okay. No, you're not. You will be okay when you actually start working on it. Because when you say nothing's wrong with me, and other people can tell that something is wrong with you, but you're denying it, that's when we look at that as you're not using your all of your strengths. People want to say it's weakness, but it's not. It's actually going to get extra help so that you can be stronger. And so another thing that we've lost, trust in authorities. Like it's gone on from, day one, but, in the last year, the things that we've experienced, what we've seen on television, like it was probably one of the few times that we see murder over and over and over in real time of a real person that wasn't television. Cinema, it was a real person that died. And when we watched George Floyd over and over again, I think that did something to us, but it also numbed a lot of people. It's almost like they couldn't even feel, because we started feeling like, well, it's always going to happen. And, we should not feel that way, because when we do, we kind of give in, and we don't need to give in. We need to develop our strengths. So how do we cope with the grief? It's not easy, and these things don't happen all at once. But, first you need to understand what type of grief you're experiencing. Educating yourself is always great. Talking to others, having support, not isolating, joining a group, seeking out counseling. Not everyone needs counseling after they lose someone or something. But these days, things have gotten so difficult with compounding factors, to where sometimes people don't even know where to start. And starting small is sometimes where you need to, begin. It's like, I can't even eat. Well, let's look at your nutrition. If you can't eat because you're feeling poorly, guess what? Everything else is going to start shutting down. If I start overeating, guess what? My cholesterol goes up. I might be at risk for diabetes or any other chronic illness that I might have a propensity to. And then I'm not even going to go to the doctor because I'm feeling so poorly. Well, that's not helping yourself or anyone else or your family. You have people that have lost positions, that are sitting at home wondering if they're ever going to be able to get a job again, and shutting down, not looking anymore, and sometimes having arguments with their significant other. Children are being affected by the whole family system. I'm just giving an example, kind of building on that example. And they're not reaching out to others. They're just isolating. That's not good. And sometimes you just need some help to move through the process. And one of the things that we, as mental health professionals, that we try to help people understand the most is that you're not going to just rely on coming to your sessions. Our hope is that you gain the skills and knowledge to be able to progress on your own, but not just that, have a support system that's able to help you. So even if it's just one trusted person, to where that person helps you get out of the house, that person is somebody that you can, do things with. It just helps you so much more than isolating, because the isolating behavior or the risky behaviors or trying to be the life of the party and nobody even knows that you're hurting, it's not going to work. When I was going through my own grief process, I had support that I didn't even know that I was going to have. You know, at the time I was here, I didn't, I just changed the contract and for a position, and I couldn't be there for my dad the way I would normally be there. I'm, you know, 3,000 miles away, but I had someone that came in, stepped in, and really took the reins and really acted as if I would have. And she was a cousin, and she didn't even have to do it. I didn't even have to ask her. But relationship helped that. You know, she had a relationship with him. She also had one with me, but she did that for me. And that helped me get through my process. And I was to move through. Now, not saying that I didn't grieve hard, and I won't even say I'm finished grieving, but I'm able to recognize the good things. And that's one of the things I want to go to next is gratitude. You know, what are the things that we can learn from the grief, the pain, and the things that we've lost? Having the ability to see the bright side in things when we're going through all of this is not easy. But when we're on the other side or in the middle, we can start looking at, okay, what did they teach me? What would they have wanted me to know? If I lost my position, can I get a better one? Can I, you know, how can I start chasing my dreams? What skills do I have? Right now during COVID, you know, there have been some opportunities that have opened up for people. They were able to get small business loans or start selling some things they didn't know that they were going to be able to sell, but they had that skill set. I work with a lot of creatives, and, you know, like 6 months in, they started making a lot more money than they were making before. I've had people that, you know, lost their jobs and, you know, changed careers or were able to find something else, sometimes not as good as the one that they had, but they were able to find something. So in all of this, we do have to have hope. Sometimes the things that we've lost and the people that we've lost, we need to forgive some of the situations that, you know, in our own hearts, you know, how we felt about them or the pain that they might have inflicted upon us. Sometimes we grow from that pain. Being able to forgive that, you know, is something that helps us grow as well. And some of the things that we've found is that people have started saying, okay, you know what, I want to educate myself. I want to get in the community and start working towards, you know, building and doing different things. So there's opportunities for growth even when we lose people. And sometimes that helps with legacy. That helps with honoring their death is by, you know, trying to continue and keep things going. Each person is an individual. You can't say what they will or won't do. You know, sometimes people walk in and, you know, I'm thinking one thing and when they are done and they're telling me and I'm like, wow, I didn't know you had all of that. I didn't know you had all of that in your history, because guess what? They held it back. Things that they should have been telling me, you know, like early on, and we could have used it, but it's like, well, you told me now, and so now we can really go. And that's when things can open up. And I say that to say this, is that if you do seek a therapist, if you do, you know, actually engage, you know, make sure that it's someone that you identify with. And, you know, it's just like going to a physician. If you feel like they aren't really helping you or treating you well, you find another one. Same thing. You don't have to just throw the baby out with the bathwater and just be like, well, I gave it a try and it didn't work. No, you know, move on to another one. And a lot of times it will be a good fit and you're able to process what you need to. You may only need 6 to 12 sessions, you know, you may not need for the rest of your life. You just need to get through this grieving process or whatever process it is that you need to get through. But my things that you can utilize to be able to seek therapy, employment assistance programs, people don't utilize this benefit. Most people have it. You usually have 6 to 8 sessions and they're with therapists. You know, I'm even on the EAP panel, and, you know, the person is able to go through, you can look on Psychology Today and see that person's name and see what it is that they, in their picture, and see what it is that they really are well versed in. And it might be a good fit for you. You try them and it's free. You know, you've already paid for that benefit, or your employer provides that benefit. Your insurance benefits. You know, some of them are, you know, like expanding. I know Teladoc is also doing it as well. And some Anthem Blue Cross are offering benefits. And then when we look at low cost counseling, say you don't have insurance, Open Path, those sessions can be $30 to $60 a session. Therapy for Black Girls, BetterHelp, Loveland Foundation, Boris Henson Foundation, that's Taraji's initiative. you have school counselors for kids that are experiencing grief. A lot of times it's good to let the school counselors know what they are going through. Because if they miss assignments or they're just not engaging, a lot of times they can, like kind of give them some leeway or bring them in. Some schools have, school psychologists or clinical counselors within the school, or they can give you low cost options for therapy, because we do have kids that are grieving in schools. And a lot of times, like it gets overlooked because guess what? They come to school, they don't tell everybody they may have lost their mom or dad or their grandparent. And nobody even knows why they're acting out or why they're so sad. And we need to, like at least identify and let someone know at the school. Hopefully you have somebody you can trust. Another way to educate yourself is through podcasts, literature, social media groups. You can go on apps, all of these different things to just try to engage in feelings, emotions. And, you'd be surprised what it can open up when you start educating yourself.